A lot of people are hearing about heart disease these days, and they are wondering whether or not this is just their imagination. What really is going on? Well, a few things that I'm going to teach you today are linked to a presentation that I had done recently where I'd been looking at what is happening with regards to statins and COVID. And this was focused on macrophage activation. And if you really need to understand this, there is a link. The course will be available in a few hours, so it's at a significant discount just there for you. It's important for us to understand these things because it seems as though what you've been hearing about is probably true. When you look at what happened here, and this is a BBC news report, and this was from the 27th of May 2025. My husband shouldn't have died from a heart attack at age 48. And this is representative of the kind of stories that people are hearing. What's more important with this is that according to the British Heart Foundation, there has been a 23% increase in the number of 20 to 64-year-olds dying of heart and circulatory disease in Yorkshire since 2019. So, this is the bit that stands out. Something about around the pandemic has had an impact in the context as to people dying. And the question is really why? Is it something about the virus or is there an elephant in the room? Nobody seems to quite understand what is going on. For those people who are cognizant or have been listening to what I've been talking about for some time, they will realize that there is an elephant that is connected to the fact that we are likely to see rising cases of this over the next few years. And that's part of what I'm trying to see if I can present to you. And it's linked to this presentation, as I said, looking at some of the characteristics around what is going on. This was the presentation, and I usually make reference to these COVID storm symptoms, mild symptoms associated with chronic immune activation. And this is a big part of what I anticipate is going on. And this is part of the course as we look at some of the characteristics about what is going on and why is it happening. The important thing is that when it comes to heart disease, you have to understand that this represents a healthy artery here, where you can see nice and smooth lining. And in coronary artery disease, you have a buildup of plaque. And it's this buildup of plaque that then causes the problem with regards to a heart attack, because not only does it narrow the artery, but if this was to tear and block the artery, that's when you would then have this region downstream from the heart being damaged. And that's the essence of coronary artery disease. The question would be, why is it occurring more frequently at this time? And this is the bit that I think people are not quite getting their head around. Let's go back to this article here a little bit, just so that you understand. As I mentioned about the British Heart Foundation, um, the senior cardiac nurse noted it's significant. The figures are quite shocking. It's a very complex situation. There isn't one factor that caused it, it's multifactorial. Now, as usual in complex situations, that's true, but there are only a couple of factors that occurred since 2019 that could be adding to this complex situation. There doesn't seem to be any mention of it. Additionally, you have here the research at the British Heart Foundation also found that in Yorkshire and Humber, that there had been a 17% rise in the number of people diagnosed with heart failure in recent years, from 59,320 in 2020 to now 69,190. This is again significant. And this is what I'm saying is that these statistics are all around us. You're not imagining it. A lot of people will discount these numbers and they will tell you that there is no clear association to the elephant in the room. I understand that. But there hasn't been adequate research to explain why this is occurring. Now, for anyone who has been following me, they will realize that I usually am focused on the principle of the COVID storm. And there's some things that are very important about this that I think are critical for you to understand what is going on. As I said, when it comes to heart disease here, this plaque is the critical piece of the puzzle. If there is anything that accelerates this plaque formation, it will increase the risk of heart trouble. And this is where both infection and the elephant seem to have a direct impact. And that's the bit that is being missed. They can't quite see what really is going on. And one of the things that I have highlighted here in this presentation, and this is all taken from the course. So please, if you're interested in the details, I explain it far more detailed in the course. But the point being that one specific type of immune cell gets overactivated, and this immune cell is what drives plaque disease. And this is something that happens in the context of COVID. Anything that is associated with spike protein is going to activate that immune cell. If that immune cell becomes hyperactivated, there is a direct connection with what happens with plaque formation. And when you look at this study here, and this is in the course again, looking at vascular inflammation, you can see that these macrophages are the primary reason why the plaque forms. They collect all of these fats, they become foamy, they accumulate under the lining, and anything that drives this process is going to then increase the speed that these plaques are formed. The faster that the plaques are formed, the more significant is the risk of not just heart, but stroke disease. The main issue is that if these points are underestimated, and in the course I address what I think is a very simple, basic strategy that can keep it in check, and it's something that you've been hearing about from a negative point of view, but you must do the course and you'll understand why this is such an important piece of the puzzle. If we can downregulate these macrophages, and there are a number of ways that it can be done, but if they can be downregulated so that they are less likely to become affected by infection or any other source of spike protein, that will decrease the risk of these kinds of things happening. We have a serious problem on our hands. And again, you can see here, additionally, according to the British Heart Foundation, there's an 11% rise in the number of adults diagnosed with diabetes, a major risk factor for cardiovascular disease. So they are intonating or hinting that this may be the cause. Now, without a shadow of a doubt, it is part of the reason. But the point is that diabetes itself is increased because of the same immune mechanism. Here we have another case where another woman who had lost her healthy and active partner, he died at just 32 from cardiac arrest caused by an aortic aneurysm, whilst he was competing in a half marathon just under a year ago. This is again macrophage activation, this time targeting the blood vessels lining the aorta, making it weak. The principles and the science are straightforward. You can therefore utilize it to therefore get answers that are relevant to what is going on. And this is the reality of where we are now. It just needs us to become far more objective with the science because these issues can and should be mitigated to reduce the risk. Just looking at some of the comments here, two friends died age 49 and 55 from a heart attack. Both had a family history of the same. And this is the reality, Donna. I appreciate that. in a sense that if they have a family history, and it usually is tied to cholesterol levels as well, those are the people that we really need to look at to try and see if we can reduce that risk in the longer term. Um, Elizabeth said, I had heart failure during COVID, a few months after I had COVID, no jab vax, but was possibly shed on by somebody with vax boosters. I also questioned the cold medication I was using. This is an example of somebody who's unvaccinated who still had heart failure. Now, it's important to note that heart failure is real, meaning that even if there was no COVID pandemic, if people had risk factors, they could have heart failure. So the question is whether or not it was temporarily close in terms of time frames to when you had the infection. The mechanisms that occur around infection can also occur around any source of spike protein. And this is the point, because we know that COVID infection itself can cause and exacerbate many of these issues. So this is the point, is that it's important to recognize that any source of spike protein is our problem. And what I am worried about is the cumulative effect of spike protein, and especially in an immune primed population who is still getting infections. This is where I think the risk is so very serious. We still have a lot of challenges ahead of us, and we still have a lot of work to do. But hopefully, as we get closer to looking at the science, the answers will come. Have a great evening.